This protein. Snack calms inflammation and joint pain. Fast. If your knees ache when you climb stairs or your fingers feel stiff first thing in the morning, you've probably tried a dozen things to feel better, but there's a small, inexpensive protein snack that keeps showing up in clinical research on joint pain and inflammation, and it's not some exotic superfood. It's something you can find in almost any grocery store, usually in a can. Today, we're talking about fatty fish, specifically snack-friendly options like sardines and salmon. What the actual research says about joint pain and inflammation, how quickly you can realistically expect to notice a difference, and how to add it to your routine the smart way. Let's start with why this matters so much for anyone over 60. Joint pain from conditions like osteoarthritis and rheumatoid arthritis becomes dramatically more common with age, and it's one of the leading reasons older adults report reduced mobility and quality of life. A big part of what drives that pain is inflammation, your body's immune response, which can become chronically elevated as we get older, a process researchers sometimes call inflammaging. When inflammation stays elevated for years, it doesn't just sit quietly in the background. It contributes to joint stiffness, swelling, and that deep ache that makes everyday movement harder than it used to be. So finding food-based strategies that are backed by real clinical research, not just wellness trends, is genuinely valuable information. So what does the science actually say about fatty fish? The key player here is omega-3 fatty acids, specifically EPA and DHA, the types found abundantly in cold water fatty fish like salmon, sardines, mackerel, and herring. Unlike many nutrition trends that fade quickly, omega-3s and joint pain have been studied in real randomized controlled trials, which are the gold standard for medical evidence, for decades now. Here's what a major meta-analysis focused specifically on rheumatoid arthritis found. Pooling data from multiple clinical trials, researchers found that omega-3 supplementation over 3 to 4 months significantly reduced patient-reported joint pain intensity, reduced the number of minutes of morning stiffness, reduced the number of painful or tender joints, and notably, reduced how much NSAID pain medication, like ibuprofen, patients needed to take. That last point is particularly meaningful because it suggests omega-3s may help some people rely less on daily pain medication, which matters given the long-term risks associated with frequent NSAID use, including effects on the stomach, kidneys, and cardiovascular system. For osteoarthritis specifically, the picture is similarly encouraging, though slightly more nuanced. A 2023 meta-analysis that pooled results from 9 randomized controlled trials involving over 2,000 osteoarthritis patients found that omega-3 supplementation significantly reduced arthritis pain and improved joint function compared to placebo. Importantly, the researchers also noted no increase in serious side effects among people taking omega-3s compared to those who didn't, which speaks to the relatively strong safety profile here. Now, here's where I want to be completely honest with you, because responsible health information means telling you what the evidence doesn't show, not just what sounds impressive. A broader systematic review looking at omega-3s across different types of chronic pain found that the strongest, most consistent benefits appeared in rheumatoid arthritis and migraine, while the evidence specifically for osteoarthritis and certain other pain conditions was more mixed across different studies. Even though, as I just mentioned, other dedicated osteoarthritis meta-analyses did find meaningful benefit. This is a great example of how science isn't always a single clean answer. Different studies, looking at different populations and different doses, sometimes produce somewhat different results, and reputable researchers openly acknowledge that. There's also an important point about timing that the title of this video promises fast relief on, so let's set realistic expectations here. Research shows the benefits of omega-3s tend to build over time, rather than appearing overnight. In the chronic pain meta-analysis I mentioned, relief was noticeable at around 1 month, but continued improving through 6 months of consistent intake. So while some people may notice subtle improvements within a few weeks, meaningful, clinically significant relief is generally something that develops with weeks to months of consistent intake, not something that happens after one snack. Anyone promising instant, dramatic pain relief from a single food is overselling what the science actually supports. So how much omega-3 are we actually talking about? In the clinical trials that showed benefits, particularly for rheumatoid arthritis, researchers often use doses upward of 2.7 grams of omega-3 per day, sustained for at least 3 months. That's a meaningfully higher amount than what you'd get from an occasional serving of fish. To put that into food terms, a 3.5-ounce serving of salmon typically provides somewhere around 1 to 2 grams of combined EPA and DHA, while sardines provide a similarly strong amount, often around 1 to 1.5 grams per serving, depending on the specific type and preparation. This means getting close to research-level doses through food alone generally requires eating fatty fish several times a week, not just occasionally. This is exactly why a simple, protein-packed snack like canned sardines or a small salmon pouch is such a practical option. It's shelf-stable, requires no cooking, delivers around 15 to 20 grams of protein per serving, alongside a solid dose of omega-3s, and can be eaten straight from the can with crackers, on top of a salad, or alongside vegetables. For anyone managing joint pain, having an easy, no-prep protein option that also supports an anti-inflammatory eating pattern is a genuinely useful tool to keep in your pantry. Let's talk about a few important precautions here, because this matters more than people realize. If you're on blood-thinning medication, such as warfarin or other anticoagulants, you should talk to your doctor before significantly increasing your omega-3 intake, since high doses can have a mild blood-thinning effect of their own and may interact with these medications. The same goes if you're already taking fish oil supplements alongside blood pressure medication, since combined effects should be discussed with your doctor. And if you have a fish or shellfish allergy, obviously this particular snack isn't for you, though your doctor or a dietitian can suggest plant-based omega-3 alternatives like algae oil supplements instead. It's also worth being clear that omega-3s and fatty fish are not a replacement for any medication your doctor has prescribed for arthritis or joint pain, and they're not a cure for any joint condition. The research consistently frames omega-3 supplementation as an adjunctive approach, meaning something used alongside standard medical care, not instead of it. If you have significant, ongoing joint pain, that's absolutely a conversation to have with your doctor or a rheumatologist, who can properly diagnose what's actually driving your symptoms and build a treatment plan around it. Let's clear up a common misconception too. A lot of people assume all fish oil and omega-3 products are essentially identical, but the concentration and ratio of EPA to DHA can vary meaningfully between whole food sources and supplements, and quality supplements are generally tested for purity, given that fish can accumulate environmental contaminants like mercury. If you and your doctor decide a supplement makes sense for you, choosing a reputable, third-party tested product is worth the extra attention. So here's what I want you to take away from today. Fatty fish like salmon and sardines are genuinely one of the better supported food-based strategies for supporting joint comfort and managing inflammation, with real randomized clinical trials behind the claim, particularly for rheumatoid arthritis and, according to several studies, osteoarthritis as well. But the honest expectation is gradual improvement over weeks and months of consistent intake, not an overnight fix. Aim to include a serving of fatty fish, whether fresh, canned, or as a simple snack, a few times a week as part of a broader anti-inflammatory eating pattern that also includes vegetables, fruits, and whole grains. And if joint pain is a significant part of your daily life, let your doctor guide your overall treatment plan, with nutrition playing a supportive role alongside it. Small, consistent habits like keeping a can of sardines in your pantry might not sound dramatic, but they're exactly the kind of evidence-based choice that adds up meaningfully over time. If this helped you understand the real science behind a food you might already have in your kitchen, share it with someone dealing with joint discomfort, because this kind of clear information is worth passing along. And if you want more honest, research-backed health content made specifically for adults over 60, go ahead and subscribe because there's plenty more where this came from.